everyone, welcome back to my channel. In today's video I want to talk to you guys about how to communicate to the doctors when you need to ask questions about your patient, if someone is declining, for example, or if you need some medication to be recharted. Like, there are lots of reasons why you would talk to the doctor, and remember that you are primarily contact to your patients, so you've represented them, you're advocating for them. So talking to doctors is going to be a very common and often thing to do for you as a registered nurse or as an enrolled nurse. And in this video I want to share my experience and just give you guys a few advices, because I've noticed when I started working as a registered nurse at the hospital, we have multiple teams of doctors working in my ward. I work in a general medicine ward. We have like respiratory, gastro, medical, surgical, oncology doctor teams, and depending on a condition that the patients come with, they will be allocated to a particular treating team and they will be looking after them. So you will need to contact one of those teams when something needs to be done for your patient. And I remember when I just started as a freshly new grad, I was really scared to talk to doctors, because to me they were like, you know, like not superior than you, but they were kind of like higher in rank when it comes to clinicians, you know. And some of the doctors would be a little bit grumpy, but the majority are really nice and polite and friendly, especially the young ones, you know. But you always feel like shy, and like when you call them, you know, like you forget what you want to say. Okay, you literally just have this like fog, like a brain fog, or you know, like a mind blank moment, and you were like you know, like, and they're really busy, so you can't stay for too long on a phone, you know, like trying to figure out what to say. So I'm gonna give you some advices in this video how to prep yourself for a phone call with the doctor, or if you're talking to them face to face, because I think like the phone calls are the most common ones, because doctors are really busy and they never on ward. They literally come to see patient for like few minutes and then you won't see them the whole day, you know. And the treating teams of doctors usually are in the morning up until like about 4 p.m. and then after that you will have your ward call doctor, which is like a general doctor, and he might not be aware in details what was going on to a particular patient, you know. So you want to try to actually communicate and ask all your questions and solve all your matters with the treating team themselves first, you know, if you have this opportunity, rather than calling then a ward call. Okay, so the first advice that I want to give you to start off, let's say that you will need to talk to the doctor over the phone, because the treating team they're not on a ward, you know. And by treating team I mean they will have a reg, which is like the main doctor, then he will have like the residents and interns working in his team who are a little bit lower like in rank, you know, they're just starting to practice, or maybe been in a practice like for a year or two or whatever. So you want to try to contact those ones first. So the first thing you want to do, once you realize that there is something need to be done for the patient, for example, someone is scoring a high blood pressure continuously, and the medication for blood pressure they only have charted for them at evening, so you are concerned for your patient because they're still scoring like 2 or 3, you know. So you need to contact the team, see whether they want to maybe chart a stat dose just to bring it down, you know, if anything else been done and it didn't work. So the last option for you would be to call to the doctor. And you need to first find out, okay, which treating team is looking after that patient. And then once you found which team looking after that patient, you look for the resident or for intern. Okay, first do not call the reg, because reg is gonna hate you for calling him, because he's like super busy. And you need to try first all the interns and the residents, and only like if they're not answering or if it's a complicated matter, you know, then you call the reg. Okay, so once you allocated the team who's looking after your patient, you call the intern or the resident and try to have everything you need for the patient with you. And by this I mean your blue chart or the bed chart for the patient, which has all the charts inside, like all your forms, like an observation form, your medical chart inside, fluid balance chart, any fluid orders inside, and any other observations that that patient is on. Just have it with you handy, and also have your handover sheet. Usually when you work in a hospital, you will have your handover sheet printed, so it will have all the information pretty much about the patient, including the background history, the assessments that have been done for that patient for the past few days. It will have also diagnosis that they presented with, and the current plan of cares for that patient, you know. So if the doctor gonna ask you some questions on the phone, it's always good to have this handy with you, so then you won't look lost or sound lost, you know, because you need to leave the phone and then go and look for the information and then come back and call them again. It's not really professional, so you want to prepare yourself, okay? So have the blue folder ready with you, you know, and when you call the doctor, so the first thing you need to say on the phone is just represent yourself, just say your name, you know, confirm that this doctor is looking after this patient. When they say yes, you know, then just give them name of the patient, full name, and the UR number, and then start to explain the reason of your call. So if it's a blood pressure, just say that the blood pressure has been scored in 1 or 2 for the past few hours of checks. You know, patient, let's say, hasn't been complaining of pain, you know, all the regular medications been given, but the blood pressure is not resolving, and the next medication for blood pressure, let's say either at night or something been given in the morning and it had no effect. So then ask, what would you like us to do? You can also suggest recommendations. You can say, are you concerned? You know, just ask, would you like to chart a stat dose of antihypertensive medication for that patient over the phone, and then we will see how we go from there. So you as a nurse, the more you practice, the more you know things, then you will feel more comfortable actually suggesting things as well. If you don't know what to suggest in the beginning because your knowledge is limited, you know, and you just started to practice as a registered nurse, it's fine, it's okay. Just ask for advice what they want to do for this patient and this current situation, you know. And then while you're talking, the doctor might ask you, can you just remind me, you know, like what this patient here is for, because you might call them when they're not near to the computer to actually check from their end the diagnosis of this patient, what they were presenting with, or any medical history of that patient. They might be just somewhere walking on a ward, you know, looking after someone, and they have a deck phone and they picked it up when you called, okay? So just be ready. That's why I'm always saying have the chart with you, so that when they ask like, oh, can you just quickly remind me why this patient is here, what has been done, you know, and all of that, so you can just quickly open and let them know. In the end of the day, when you will be doing a progress note, just make sure to document that you have contacted a treating team. The treating team charted, let's say, a stat dose of amlodipine or whatever for blood pressure, just to bring it down, you know. It's been given, you know, and then you can say like either awaiting effect if the situation happened towards the end of the shift, or you can say it was given with good effect. QADs are 0 now, blood pressure went back to normal or to safe range. Also, when you receive a phone order for the medication, like in this situation here, if the doctor decides to chart a stat dose, just call another nurse with you, okay? So he will repeat to you the name of the medication, the dose, the route of the dose, whether it's an oral or subcut or MI or whatever, and then you will need to ask him his name, so you could put it in a stat dose. So you can actually write it in the stat dose on a med chart while you're talking to him on the phone, because he is not with you in person. So you can actually write it in. You can write the order as a stat in the beginning of your medical chart, and then once you receive the order and you wrote it down, you call the other nurse, and the doctor will repeat exactly the same order, starting with the name of the medication, the dose, and the route, so she could listen to it, confirm, and read what you wrote, and then she's going to co-sign with you on that order as a stat dose. And you really need to have a name of the doctor, just if anything happens, you know that it's been done over the phone and that was the doctor who actually gave you the order. Because a lot of times when I was grad, just a beginning grad, I was forgetting to ask the name, you know, so the other nurse was reminding me. But sometimes we get really busy and the other nurse might forget, so just remember it's important to ask the name and put it in the chat as well. You as a nurse also need to be aware that whatever is happening to your patient is very important for you to address to the team if it's something like abnormal, because in the end of the day you are the person who is advocating for your patient, because you are a primarily contact to them or a point, because you always staying with your patient the whole shift, so you know them, you know what's been going on, you know the tasks and everything you've done for the patient, all the observations that you've been taking, you know. So if anything goes wrong, you know, you will be the one who will be advocating for your patient, you know, to the treating team, because they don't know. They literally come for a minute or two to just check on a patient, tell them the results of the bloods or MRIs or whatever, or any other assessments and tests has been done to them, you know, and then they might update them on a care plan, what's going to be happening to them in the next few days, or maybe they're going to be discharged, and that's it. They do not stay with the patient the whole day. You are the one who's staying with the patient most of the time, okay? So you will be advocating for them. This is why it's very important, and I thought I will just make this video for you guys, because you will be dealing with doctors quite often, okay? With time, I think for me it took me about maybe 3 months or so to feel a little bit more confident. Like the first month was the most hard one, because I was still shy, I was scared, I was losing words, you know, but then I kind of found my way how to prep myself so that it would be easier for me and more time sufficient for them, because I don't want to talk to them really long time on the phone, and they won't talk to you long on the phone anyway. Literally, like the whole conversation when you talk to doctors on the phone lasts probably for like max 5 minutes, you know, unless it's something really complex and stuff like that. But you just need to make sure to squeeze everything in that 5 minutes phone call, you know. And this is how I found my own way, how I can prep myself to be more professional, more time sufficient, and yet give enough information for them to do the right decision to what advise me to do with the patient, you know, and not to waste their time as well. So let's just recap by the end of this video. So just make sure to know what the treating team of your patient is. Have all your things ready before you call them. By this I mean the chart of the patient, your handover sheet as well. When you call them, just represent yourself by saying your name, saying the word, and then saying the full name of the patient and the UR code, and then just explain to the doctor what is the matter. If the doctor asks you to give a little bit more information, if they're not near to the computer about the patient, just open up the handover sheet, have a look what is the background history, what they represent in diagnosis, and what has been done, and then just give a little bit of updates how the patient has been going today and what you have done as a nurse. All of this is just briefly in few words, but you have it all handy in front of you. And then ask advice, and you can also suggest according to your experience how long you've been working, how confident you feel in yourself, you know, and then you can also suggest to the doctor as well. Doctors are really nice, you know, most of them, and they won't say anything to you if you suggest something, because again, you're advocating for your patient, and if you have some good suggestion, they will take it in consideration and agree on it. If it's something that they think that, okay, it's not gonna work because of such and such reason, you know, it's okay still. Like, they're not gonna make you feel stupid or anything like that, okay? So do not be afraid to suggest something. The more you work, the more your knowledge grows, and you will become more like aware of the things, and you will have more things to suggest because you will understand and know more, you know, and you will feel more confident. Yeah, so I hope you will I hope this video will be useful for you. If you have any more questions, just leave them in the comment sections below. I always read your questions, and I try to make the videos upon these questions so that I can address something that you guys asking me about, because I know that it's important for you, so I always look in the comment section below the videos and try to make a new content, you know, answering your questions, so you could learn something from my own experience while I'm still learning as well while working in this field. So thank you for watching this video, and I'll see you in the next one. Bye.